Hello viewers, today we have with us Dr. Siddhart Yadav, Consultant Orthopedics and Joint Replacement Surgeon at Apollo Hospitals, Navi, Mumbai. Today on this live session, we'll be discussing on arthritis and joint replacement. Doctor, we'll start with our first question. What are the stages of arthritis and treatment option available?
Good question. So arthritis, knee arthritis has various stages. There are normally four stages: very mild stage, moderate, severe, and very severe. So in very mild stage, most of the time, patient have very minimal pain, only on stair climbing or getting down, and that can be managed by medicine and exercises. Stage 2 is pain on walking and typically on the inner side of the knee joint. That also is managed by weight reduction because weight is the main risk factor. Number 2, activities modification, not to sit on floor, not to do stair climbing, not to do squatting, skipping, jumping, this kind of activities wherever you are impact loading your knee. And number 3, some medication. Medication mostly are for pain management and some medication to increase the health of cartilage. So this is the mainly the treatment. When arthritis is very severe, severe arthritis means when it affects your day-to-day activities. Every day when you get up and you walk and you say my knee is hurting. Whenever you go to out of your house, your knee is hurting. Whenever you climb, your knee is hurting. And for that reason, you have to take painkillers, and that too every day or alternate day. That we classify as significantly severe osteoarthritis. To diagnose it, we do the X-ray that confirms the severity, means the cartilage is no cartilage in X-ray, the bone is touching bone. And in that case, we have two options. One option is we can try the lubricating injection, we call the synovial fluid replacement therapy. In that, through injection, we inject lubricating material. Sometimes we inject PRP, sometimes we inject protein supplements, which we derive, which we make from your own blood, and that also helps sometime up to 1 year. In some cases, when there is no relief, physiotherapy has failed, medication also failed, and you require lots of painkillers, and that time X-ray showing your bone is touching bone, and then we advise knee replacement. Because if you delay knee replacement and you continue to take painkillers, then we have many side effects of due to painkillers. Number one side effect is gastric ulcer. You get erosion in your stomach, and that is sometimes very serious. Number two, you get kidney failure. Almost 7% kidney failures are due to painkillers. And number three, when you are not walking enough, you are not putting weight on your bones, then your muscles they get weak, and bones also get weak because we are not putting enough weight on our bone. So due to these all these things, and if we delay further and we don't opt for surgery, and in the end what happens? You can't walk and you are bedridden or wheelchair bound. If you go for knee replacement at that stage, then the recovery takes more time, complications are more, and we don't advise somebody should delay TKR till that stage when recovery is very slow, outcome is also not so good.
Is it safe to undergo surgery in COVID era?
Yes, we can do regular joint replacement surgeries right now during this pandemic because we are taking extreme care from OPD, ward to OT. We have separate entry and exit for patients who are medical patients for cough and cold, and those who are our orthopedic cases. And we don't mix cases. Even the staff for these cases is different, ward is different, operation theatre is different. And from beginning of the lockdown, we have never stopped our operation theatre or routine because we got many fracture cases, people fell down, and we never denied any operation or any treatment. We continue to operating, and now for last 2-3 weeks, our operative work has increased, and we are also starting now TKR and THR because our protocols are good, and in our last 2 months, our clinical results are good. We are JCI accredited hospital. We have special infection control units, and we do daily basis lot of infection control drill. And during our last 3 to 4 years, our infection rate in joint replacement is almost less than 1%. As per the global standard, we are always we have maintained very good infection control. And after pandemic, we have taken special care. Even in OPD, we do wear full PPE. In OT also, we have introduced new equipments to control the spread of aerosol. And I'm sure we are we are doing whatever the best possible, and we are very safe for the joint replacement. Thank you.